Hypoxia. Hypoxia is decreased oxygen in a tissue. Hypoxemia is decreased partial pressure of oxygen in a arterial blood flow. Next is hypoxia, most common hypoxia due to ventilation perfusion mismatch. Due to high altitude, decreased ventilation, fibrosis. It is due to decreased partial pressure of oxygen in the arterial blood flow. This is ventilation and this is tissue. So decreased partial pressure of oxygen in the blood. And partial pressure of oxygen will be decreased. Saturation of oxygen will be decreased. Dissolved oxygen will be decreased. Hemoglobin oxygen decrease. And content of oxygen also decrease, and the content of arterial venous oxygen also decrease. So arterial and venous oxygen difference will be normal because both will be decreased. That is hypoxia. Next is anemic hypoxia. Anemic hypoxia is due to carbon monoxide poisoning, anemia, methemoglobin. In this, partial pressure of oxygen will be normal, saturation of oxygen will be normal. But in carbon monoxide poisoning, the saturation will be decreased, saturation of oxygen will be decreased. But when we use a pulse oximeter, the SpO2 will be normal because false normal because due to cherry red color, because carbon monoxide poison causes cherry bright red color. Dissolved oxygen will be normal in anemic hypoxia, but hemoglobin is reduced, so it will be low. And total arterial oxygen will be low, and venous oxygen content will be low. So when we minus arterial and venous oxygen, it will be normal because the two arterial and venous oxygen will be low. Next is stagnant hypoxia or ischemic hypoxia, decreased blood flow due to hemorrhage, heart failure, shock. In this, oxygen will be normal, saturation of oxygen will be normal, dissolved oxygen will be normal, hemoglobin will be normal, and content of oxygen will be normal. But due to stagnation, the arterial blood flow in this we cannot there is problem in the blood vessel, so when the tissue it cannot carbon dioxide it cannot be so the venous oxygen will be low. When we minus arterial and venous oxygen, it will be increases. Next is histotoxic hypoxia. It is due to cyanide poisoning due to cytochrome oxidase inhibitase enzyme and electron transport chain due to inhibition of that enzyme. In this, partial pressure of oxygen will be normal, saturation of oxygen will be normal, dissolved oxygen will be normal, HbO2 will be normal. But the CbO2, that is the content of oxygen in the venous will be increased because it is problem in the tissues. Hypoxia mainly due to to stimulate the peripheral chemoreceptors, especially in the carotid body. The large blood supply is there, glomerulus cells is there. 200 ml per 100 gram per ml, and dissolved oxygen will be sufficient for the peripheral chemoreceptor. But in hypoxia, the dissolved oxygen will be reduced, so the peripheral chemoreceptors will be activated. Anemia, dissolved oxygen will be normal, there is no chemoreceptor, so peripheral chemoreceptors only activated when there is decrease in the oxygen content. Stagnant hypoxia also, this arterial vein, the dissolved oxygen will be decreased, so there is chemoreceptor activation. In histotoxic hypoxia, the chemoreceptor mostly stimulated in the histotoxic hypoxia. Cyanosis is due to the deoxyhemoglobin is increasing 4 gram percentage, methemoglobin more than 1.5 gram percentage, sulfur hemoglobin more than 0.5 gram percentage. The saturation is 97, deoxyhemoglobin is 3 percentage. When we calculate this, 15 gram is the normal hemoglobin into 3 by 100, that is 0.05. In the venous also saturation is 75, deoxy 25 percentage. 50 gram into 25 by 100 is equal to 3.75 gram percentage. Deoxyhemoglobin in capillary is so when we calculate 0.045 plus 3.75 divided by 2, it causes 2.1 gram percentage. Cyanosis is due to hypoxia. There is saturation of oxygen will be decreased and the saturation of venous oxygen will be decreased. It causes cyanosis. In anemia, the hemoglobin decreases, the cyanosis will be rare because in carbon monoxide also cyanosis will be not in there, but the hemoglobin cyanosis like. Next, stagnant hypoxia, saturation of venous oxygen decreases, so cyanosis will be more. Extra-toxic, saturation of oxygen will be normal, so saturation of venous oxygen will be more, so never the cyanosis will not be present in histotoxic. The most sensitive hypoxia center is hippocampus, that is CA1 Somers and Purkinje cerebellum, basal ganglia striation, and most resistant is spinal cord. This is hypoxia. Thank you.